Eating healthy can feel like a challenge, especially when you're trying to keep blood sugar in check or take it easy on your kidneys. But what if the solution isn't about cutting everything out, but adding the right foods in? In this video, we're sharing 9 simple, delicious foods that are not only great for managing diabetes and kidney health, but are also packed with nutrients anyone can benefit from. Whether you're managing a condition or just looking to eat smarter, these options are for you. Before we dive in, please note, all the information in this video is thoroughly fact-checked, unbiased, and reviewed by qualified professionals. Number 1 is eggs. Eggs are one of the most nutritious foods available, containing high-quality protein, healthy fats, vitamins, and minerals, all with virtually no carbs and sugar. A single large egg provides around 6 grams of protein, which can help with satiety, calorie burn, and blood sugar regulation. Research shows that the high protein and healthy fat content in eggs can help stabilize blood sugar levels by slowing digestion and preventing sudden spikes. In fact, eggs are considered a complete protein because they contain all 9 essential amino acids, which can support people with chronic kidney disease, CKD, who need high-quality protein to maintain muscle mass and repair tissues. To incorporate eggs into your diet, aim to consume up to 1 egg per day if you have diabetes or kidney concerns. Boiled, poached, or scrambled eggs make a great addition to breakfast or snacks. When shopping, opt for free-range or organic eggs for the highest quality and avoid fried eggs if possible to limit added fats. While eggs are generally safe for most people, those with very high cholesterol levels should consume them in moderation. Consulting with a healthcare provider for personalized advice can ensure eggs fit well in your diet. Number 2 is salmon. Salmon is a protein powerhouse and is rich in omega-3 fatty acids, which are essential for reducing inflammation in the body. With no carbs or sugars, it's an excellent choice for people with diabetes and kidney issues. A 3-ounce serving of salmon offers around 20 grams of protein, beneficial for muscle health and metabolism. Omega-3s in salmon play a significant role in reducing inflammation, which is crucial for kidney health. Research has shown that omega-3s can improve lipid profile and lower inflammation markers in the body, and they may also support kidney function by lowering high blood pressure, a common issue for people with diabetes that can also damage kidneys over time. Additionally, these fatty acids support insulin sensitivity, helping to keep blood sugar stable. For maximum benefits, aim to eat salmon 2 to 3 times a week. This lets you reap all the health benefits while minimizing the risks. Salmon may contain mercury and other contaminants, especially larger, older fish. Try grilling, baking, or even adding cold-smoked salmon to salads or wraps for variety. Wild-caught salmon typically has less saturated fats and provides fewer calories than farm varieties. Also, farmed salmon can have much higher levels of pollutants, like PCBs, with up to 16 times more than wild fish. A tip for either type is to remove the skin to reduce exposure. Plus, farmed salmon is often treated with antibiotics, and while antibiotic use in farmed fish has reportedly decreased, it's uncertain by how much. Wild salmon does not have this concern. Are you enjoying our videos so far? If so, please give us some hints by dropping a like, and we'll make more content like this. Number 3 is olive oil. Olive oil, particularly extra virgin olive oil, is a heart-healthy pure fat with no carbs or sugars, making it a great choice for managing blood sugar. Olive oil is primarily composed of monounsaturated fats, which are linked to reduced inflammation and improved heart health. Research highlights the anti-inflammatory effects of olive oil's polyphenol, which may help prevent kidney damage by lowering inflammation levels in the body. In people with diabetes, olive oil can improve insulin sensitivity, helping to keep blood sugar levels more stable. Adding 1 to 2 tablespoons of olive oil to your meals each day can enhance both flavor and health benefits. Use it as a dressing, drizzle over vegetables, or substitute it for butter in cooking. When shopping, look for cold-pressed extra virgin olive oil for maximum nutrient content. Olive oil is generally safe for everyone, but because it's calorie-dense, using it in moderation is best to prevent unwanted weight gain. Number 4 is tuna. Tuna is another excellent protein source that's carb and sugar-free, making it a great addition to a low-carb diet. Plus, tuna is packed with omega 3 fatty acids, vitamins D and B, and minerals, making it highly nutritious without impacting blood sugar levels. Tuna's omega-3 content is particularly beneficial for reducing inflammation, which helps protect the kidneys from damage associated with diabetes. By lowering inflammation and oxidative stress, eating tuna can help control blood sugar levels and may even reduce the risk of kidney-related complications over time. Additionally, research has suggested that the protein in tuna helps with satiety and can prevent blood sugar spikes by slowing digestion. Including tuna in your meals 2 or 3 times per week is ideal. Opt for fresh or low-sodium canned tuna to avoid excess salt intake, especially if you have kidney concerns. Tuna works well in salads, wraps, or even as a main protein in dinner dishes. While tuna is generally safe for most people, it can contain mercury and dioxin, so it's best to limit intake, especially for pregnant women and young children. Choose smaller fish like skipjack over larger varieties to reduce mercury exposure. Number 5 is chicken breast. Chicken breast is a lean protein with 0 carbs and sugar. A 3-ounce serving of skinless chicken breast contains about 22 grams of protein and is low in fat, which helps with satiety and muscle maintenance. High-protein foods like chicken breast are beneficial for those with diabetes because they slow down the absorption of glucose, helping to prevent sudden blood sugar spikes. Additionally, research has shown that diets high in lean protein may help improve insulin sensitivity over time, and protein itself can help stimulate insulin release to manage glucose levels, which is particularly helpful for people with diabetes. Including 3 to 4 ounces of chicken breast per meal is a healthy portion size. Have it 3 to 5 times per week to reap the health benefits. Try grilling, baking, or roasting chicken breast with herbs for flavor. Look for organic or free-range chicken when possible for the best quality, and avoid processed or fried chicken options, as these often contain added fats and sodium. Chicken breast is safe for most people, but individuals with advanced kidney disease should monitor protein intake carefully, as excess protein, especially from animal sources, can be hard on compromised kidneys. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. Now, as we go through more foods that are almost carb and sugar-free, here's a quick heads up. Eating low-carb, sugar-free foods can be especially helpful for people managing diabetes or kidney concerns. But a low-carb diet does not mean just loading up on meat and eggs. This is particularly crucial for anyone with kidney concerns, where a diet heavy in animal protein can increase acid, sodium, and phosphorus load, adding unnecessary strain to these vital organs. While these foods make headlines for their zero-carb content, the secret to lasting health isn't about eliminating carbs entirely, it's about making smarter choices. Carbs are actually a vital part of a balanced diet. They give us the energy we need, and eating glucose can give our brains a boost. However, not all carbs are created equal. Eating simple carbs like sugar may spike blood glucose quickly and trigger inflammation. As our body requires no added sugars to function well, it's best to avoid sugary foods. In contrast, fibers, often found in plant-based sources, are a great type of carbs that are not digested, not being counted toward the net carbs, and do not raise blood sugar levels. Plus, fibers help reduce inflammation and acid load, a win-win for people with kidney disease and diabetes. Again, the goal isn't to eliminate carbs completely. It's to make informed choices that keep your blood sugar stable and your kidneys happy. Now, let's dive into our next low-carb, high-fiber options. These foods pack in great nutrition while helping to keep your blood sugar levels steady. Number 6 is avocados. Avocados are creamy, delicious fruits loaded with healthy monounsaturated fats, fiber, and essential nutrients like potassium and magnesium, all with almost no sugars. Net carbs are very low, 1.5 g, due to high fiber content. A single avocado, 200 to 250 g, provides about 10 g of fiber, which supports digestive health and helps manage blood sugar by slowing digestion. While an avocado also has about 13 g of carbs, most of that is fiber, so the net carbs are only 3 grams. Avocados are especially beneficial for people with diabetes and kidney issues due to their high potassium content, which helps regulate blood pressure, a critical factor in protecting kidney health. High blood pressure is also a concern for people with diabetes. Research has shown that avocados' healthy fats and magnesium can help improve insulin sensitivity, helping maintain stable blood sugar levels. Plus, the antioxidants and vitamins C, E, and K1 help reduce inflammation, supporting overall kidney health. Including half an avocado in your diet daily can provide these health benefits without adding too many calories. Enjoy avocado in salads, smoothies, or as a topping on toast. When selecting avocados, look for slightly soft ones if you plan to eat them immediately, or firmer ones if you want them to ripen at home. While avocados are nutrient-rich, their high potassium levels mean that individuals with advanced kidney disease should consult a healthcare provider before consuming them regularly. Number 7 is mushrooms. Mushrooms, especially varieties like shiitake and button mushrooms, are a wonderful source of fiber, B vitamins, and antioxidants with almost no sugar. Mushrooms are low in carbs, with around 3 grams of net carbs per cup, 70 to 80 g. They offer a meaty texture and are loaded with selenium, an antioxidant that supports kidney health. Mushrooms have immune-boosting and anti-inflammatory properties. Research has shown that compounds in mushrooms may help reduce oxidative stress, which helps the body's ability to maintain stable blood sugar levels. Mushrooms also provide a decent amount of vitamin D, which has been linked to improved kidney function by reducing inflammation and protecting kidney cells. Aim to include a variety of mushrooms in your diet, with a serving size of about half a cup to 1 cup cooked. Sauté, grill, or add mushrooms to soups and stews for a savory, low-calorie addition. Fresh or dried mushrooms can both be nutritious, but avoid canned varieties high in sodium if you have kidney concerns. While mushrooms are generally safe, some wild mushrooms can be toxic if misidentified. Poisoning symptoms can range from mild digestive issues to severe effects like liver or kidney failure. Always purchase from a reliable source or choose cultivated varieties. Number 8 is bell peppers. Bell peppers are colorful vegetables that are low in carbs and sugars. Despite containing some sugar, they won't raise your blood sugar. Actually, they might even help lower it. Plus, bell peppers are very low in calories, making them ideal for those managing weight and blood sugar. They are also nutrient-dense, with a high content of vitamins A, C, and several antioxidants. These nutrients make bell peppers a powerful anti-inflammatory food that supports both immune and kidney health. The antioxidant content in bell peppers, particularly vitamin C, helps combat oxidative stress and inflammation, which can benefit people with diabetes by protecting their blood vessels and kidney cells from damage. High blood sugar levels over time can weaken blood vessels in the kidneys, so antioxidant-rich foods like bell peppers can offer protective effects. Add half a cup of bell peppers in different colors to your daily meals 3 to 5 times a week. You'll get all the benefits without affecting your blood sugar. They're delicious raw in salads, sautéed in stir-fries, or even roasted as a side dish. Choose fresh, vibrant peppers when shopping, as they contain the most antioxidants. Bell peppers are generally safe for everyone, though those with digestive sensitivities to nightshades may need to limit their intake. Number 9 is kale. Kale is a versatile, low-carb vegetable packed with vitamin C, K, and B9, along with fiber and minerals, all while containing almost no digestible carbs or sugars. In fact, out of all the cruciferous veggies, kale packs in the most fiber, while having the fewest net carbs. 100 g of kale gives you around 4 g of fiber. That's 15% of your daily value. Kale is great for keeping your digestion smooth and blood sugar steady. Additionally, kale contains potent antioxidant compounds like glucosinolates, indoles, and isothiocyanates, which can help reduce inflammation and even fight cancer cells in the body. Plus, the low phosphorus and sodium content makes kale suitable for kidney patients. However, those on potassium restrictions should note that 100 g of kale can contain up to 348 milligrams of potassium. To lower potassium levels, you can cut your kale into small pieces and soak it in or boil it with warm water. Adding a cup of kale to your diet each day is a healthy way to boost your intake of nutrients without affecting blood sugar. Kale also has a mild flavor that blends well with other diabetes and kidney-friendly ingredients, making it a practical staple. You can enjoy kale raw in salads, lightly steamed as a side dish, or blended in green smoothies. Roasted kale with olive oil, garlic, or onions is another tasty, low-carb option. Kale is generally safe for most people, but those with digestive sensitivities, like irritable bowel syndrome, IBS, may want to consume it in moderation, as it can sometimes cause gas or bloating due to high fiber content. Conclusion. And there you have it. Our suggested 9 foods provide a combination of lean protein, healthy fats, antioxidants, and vitamins, all without the carbs and sugars that can cause blood sugar spikes. Each food on this list supports a balanced diet and can benefit both blood sugar control and kidney health, 2 priorities for most older people, especially those with diabetes, as high blood sugar can damage the kidneys over time. Remember, we're not on a carb-hunting mission. It's not about going completely carb-free or loading up your plate with just meat and eggs. That approach could actually backfire, especially if you have kidney concerns. While simple carbs like sugar come with many risks, fibers are your go-to carbs. They don't count toward net carbs, don't spike blood sugar, and actually help calm inflammation. By carefully selecting foods that are low in net carbs and high in fibers, antioxidants, and other nutrients, you can enjoy satisfying meals while protecting your health. Don't forget to consult with a healthcare provider or a nutritionist who can help tailor dietary choices to your individual health needs, particularly if you have advanced kidney disease. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Everything we've discussed in this video might be wasted if you don't watch the video on the screen. Here, we share the worst 22 foods that can ruin your effort to take care of your kidneys and offer tips on how to still enjoy them or find great alternatives. See you there. Stay informed, stay healthy,